and he had ADHD, and that was my motivator. I'm going to go out and educate and help others so that they don't have to go through what I went through. So I went back to school, first day, found out I was pregnant. I cried. But my husband said, you don't have to do this. No, I started it. I'm going to finish it. That's what we tell the kids. So I went on. Of course, you know, when you're old, it takes a little bit longer. So 4 years went on to 5. But I got that degree. Before I got it, I decided I was going to be a school social worker because that's how I can reach people. So I went and applied for a job, and they said, you need your master's. Fine, okay, I'm going to get my master's. We only had 5 children then. And remember, the baby went to school with me sometimes. Anyhow, I found out I had to go and get my master's, so okay, I applied. Go and get my master's. They turned me down. I cried. A colleague said, Paula, you can do better than this. You put on your big girl panties and go out there and do it again. So I applied again. I didn't get it. So the first time it hurt me, the second time it got me mad, so I just went on up here to Baton Rouge and said, hey, what do I have to do? I'm supposed to be here. So they let me in. Carmen's telling me this, I gotta hurry up. I want to say that I had some wonderful people that I've worked with. One was Dr. Campbell, who then taught my little bitty girl, and my supervisor, Mr. Budge, and then of course Randy Roach, who works with the Ulster Project, Mayor Roach. All these people have helped our community and helped make people great people.
Dr. Carol Campbell has been involved in the training of social workers and the evaluation of human services for many years. Dr. Campbell grew up in Valdosta, Georgia. She received her BS degree in sociology and anthropology from Valdosta State, her MSW from LSU in '87. She also has a master's degree in criminal justice and a PhD in sociology, concentrating in the family, with a minor in social work. She is currently on the faculty at McNeese State University. Dr. Campbell has served in many capacities within the NASW-LA wherever she has lived, that is Alexandria and Lake Charles. She has been a member since 1986. She has been the Alexandria Branch Public Relations Officer, the Lake Charles Regional Chairperson. She was awarded the NASW-LA Board of Directors Award and was a Social Worker of the Year. She has facilitated NASW-LA regional trainings and has been the chapter office's go-to lady for many events, and right now for this current chairperson. She has provided numerous trainings for NASW-LA in our regional meetings, and topics she has presented on include clinical ethics in marriage and family counseling, membership trends and implications for social work professions of Louisiana, narcissistic disorders, which sounds like us who get to be talking and professional development and growth. We go on, and she is really great. She's done a lot of stuff. Carol currently serves on the board of directors for the Organization of Women and Mothers and the Louisiana Mental Health Association.
I am humbled and honored to be given this award. My deepest thanks goes to the members of the Region 5 National Association of Social Workers. I really think of them more as Southwest Louisiana Corner or Lake Charles. I would like to particularly recognize their awards committee. Their awards committee ended up nominating 5 of the awards that are given out today at this statewide meeting. That committee really worked hard to get all that paperwork together. I'm very impressed with them. And the social workers in the Southwest Louisiana Corner have been my dedicated partners. They've always been willing to volunteer kindly their time, their talents, and their resources. Sometimes without even being asked, they just volunteer and get things done. I share this award with all of my mentors, advisors, partners, and friends in this journey I've taken as a social worker. We have many wonderful social workers throughout the state of Louisiana, and I've repetitively benefited from their wisdom, their support, and their generosity. You are all leaders. You are all the fabric of your communities. I am so happy to be among all of you.
It's my pleasure to introduce you to Ronald R. Budge, who is an LCSW, the BACS, ACSW, who has been a member of NASW since 1963, 51 years. He was one of the first licensed social workers in the state of Louisiana, and I remember when we started that process. And his claim to fame is that he's the oldest working social worker in Louisiana. Like many of our generation, Ronnie began his career in social work with what was then called the Department of Public Welfare, which later branched out into public assistance, child welfare, and then through many name changes later, he has moved on to other pursuits. He has experience in providing child welfare services and mental health services in the public sector. He's been a therapist, a supervisor, an administrator. He has served as a clinical therapist and administrator for 3 hospitals, providing services to those with mental and emotional problems. At the present time, he's the Director of Social Services at the Allen Parish Hospital Recovery Unit. Ronnie was instrumental in establishing both the Family and Youth Counseling Agency in Lake Charles as well as the Big Brother, Big Sister program. Both these programs were established in the early 1970s, and to this day, they are 2 of the most viable and most innovative social services programs in Southwest Louisiana. And he developed the first employee assistance program. He's done so many things and he's done it quietly, and never one to go out and toot his own horn, but he served as a consultant to adolescent group homes, Veterans Affairs, and others, and he does not accept any per diem reimbursement for his consulting work. He's been appointed to 2 governors' commissions by 2 different governors. He was appointed by then Governor Edwin Edwards to the State Advisory Committee on Mental Health, and more recently by Governor Bobby Jindal to the Prenatal and Infant Mortality Commission. And that commission is charged with the responsibility of developing state plans for reducing infant mortality and reduction of teen pregnancy.
I guess what stands out in my career would be the Family and Youth Counseling Agency, because when I started that, I actually didn't start it. It had a board of directors, an excellent board of directors, excellent board chairman, and funding for 1 year. But I was the only staff person there. So I really did have to do it all. And then the Big Brothers and Big Sisters program, you know, I have to say about that is I did work with my board of directors and the board of directors of United Way and the director of United Way, and we did get it approved to start the program. But my wisdom was in hiring Fred Rickman to run the program, and he won this award last year. So I'm very proud of him for doing that, and won it at a much younger age. So my son said if I stay till I'm 91, I might win a national award. I didn't really raise him right. But on a personal note, I'll just end with this. In October, I had a bad case of pneumonia. And the doctors kept saying, "You have a bad case of pneumonia." And that's all I heard, "You have a bad case of pneumonia." They didn't tell me I had a 35% chance of living, 65% chance of dying. They told me that later. But the thing that really struck me, and it's kind of, it goes to social work, I wasn't getting any better. The doctors were doing everything they could do. They were wonderful. I had 2 wonderful doctors. But I wasn't getting any better. And the one doctor that was working with my stomach, because I developed stomach problems, she was just as sweet as she could be, smart as she could be. You couldn't help but love her, and she would put things just matter of fact, but she'd never fuss at you, never demand anything. And then she said, asked me if I had eaten my dinner, and I said, well, I drank the Ensure. And then for the first time, she had a little frown on her face, her voice raised a little bit, and she said, you have to try. And it just got through to me. I don't know, I didn't want to disappoint her. And then it came down to the realization that everything was on my shoulders. I mean, they had done everything they could do, and I couldn't get out of there until I made up my mind I was going to do. I thought I was doing what I was supposed to do. But that's when I realized it, and I think, how many patients have you had or clients have you had? It's right in front of their face, but they can't see it, and you just have to wait on them to get there till they see it. And you have to realize, for your longevity, not to work harder than they do, and remind yourself not to work harder than they do, or you'll burn out. You know, they're in the United States. They have the right to make the wrong decision if that's what they want to do. And you have to be patient with them and try to help them get where where we would like to see them get, not always where they would want to get. So, you know, it's just to say thank you. It's kind of a cliche, but to let you know how much I appreciate this award, I'm giving all the money to charity.